Hello, everyone, and welcome to today's panel discussion, Empowering Girls Through Reproductive Health Education, Global Insights and Interventions. My name is Barbara Moreno-Paschal, and I am honored to serve as president of Harvard Alumni for Global Women's Empowerment, or Global WE. Founded in 2013, Global WE is a shared interest group of the Harvard Alumni Association that is dedicated to the empowerment of women through education, dialogue, and connection among individuals working for women's rights and freedoms worldwide. We highlight and raise awareness about issues concerning women's empowerment worldwide, including, but not limited to, education, political rights, freedom from violence, women's health, and economic empowerment. Global We is an organization that is firmly committed to political neutrality. Our apolitical position allows everyone who joins our events, regardless of political or ideological viewpoints, to participate freely and openly. As with all of our programs, we would like to remind our audience that the statements and positions expressed by our speakers today are their own and do not necessarily represent or reflect the position of Harvard Alumni for Global Women's Empowerment or Harvard University. Our board of directors is as global as our interests, with representatives in the United States, Asia, Europe, and the Middle East. In fact, I live in Cleveland, Ohio, and other Global We board members and advisory council members and friends present today are in India, Turkey, Kenya, Pakistan, and different parts of the United States. I invite you all to please share in the chat where you are coming from today to join our conversation. Also, before we start, we would like to take a screenshot for social media purposes. If you are willing, please turn on your camera so that we may take this photo and capture the moment from today's event. And if we can have a countdown for this photo, please.
All
RT.
right. 3, 2, 1. Everyone smiles. One more. We have lots of cameras on today. Okay, 3, 2, 1. Smile. Thank you. Thank you, everyone.
Thank you, RT. If you have not already done so, please mute yourself so we may begin our presentation. Please type any questions you have for any of the panelists today in the chat, and we'll make sure to include them or share them with the panelists for follow-up if we don't get to them today. You may also have a chance to ask questions of the panelists in the breakout sessions later on in this presentation. At this time, I'm pleased to introduce Leah Keene, who is our President Emerita and who will introduce us to some very special guests today. Leah, over to you.
Thank you so much, Barbara. As many of you know, our International Essay Contest for High School Students is our flagship program in over 20 countries. If somebody could put the essay contest link in the chat, that would be great. Today, we are delighted, and I'm so proud that we are featuring contest participants from the Philippines, where I'm from, whose essays that were written in response to the annual prompt, "What is the biggest issue facing women and girls in your country today?" happen to match the topic of today's panel. I found their essays thoughtful, passionate, and informative, which gives me hope that the youth who today are fighting for a future that is closer to gender equity than it is now. The links to their complete essays were sent out ahead of time and will be included in the follow-up email that will be sent to all of you. Today, we're going to hear excerpts from them, and you'll have a chance to chat more with them in the breakout rooms after the panel. I'm going to kick off. I have an excerpt from Janine Hung, who was the winner in 2023, who could not join us today. And her essay was titled, "The Timeline of Being a Woman in the Philippines." Virginity is a commodity that can be taken but never returned. Girls are protected from anything in this world that could stain their dignity, their bodies. Despite this, 500 adolescent Filipinas give birth daily. Despite this, adolescent pregnancy is a national emergency. The very culture that swears by virginity is the same culture that drives them into exploring sex with their own inadequate understanding of it, which leads to higher rates of adolescent pregnancy. Abortion is not a choice for them. Girls and women must take responsibility for her actions. Sex has consequences, after all. If it wasn't her choice to have sex, it is still her duty to harbor life. The fetus's rights exist too at the expense of hers. Her body, our bodies, then belong to the morals of others. There are 600,000 women who get an unregulated abortion yearly in this nation, and 1,000 women will die from the succeeding complications. As a Catholic country, the Philippines forces its morals on its women, ensuring their sufferings and even their deaths. That's from Janine. And now I'd like to hear from Irvin, who's one of our winners from last year's contest.
Good day to the panel
Irvin, there you
moderator.
are.
Good day to the panel moderators, fellow speakers, and everyone in attendance. My name is Irvin Owen T. Lares, and it is truly a privilege to be a part of this important discussion. I would like to read an excerpt from my essay entitled Strength Beyond Struggles, Celebrating Single Mothers in the Philippines. With one of the highest teenage pregnancy rates in Southeast Asia, the Philippines sees thousands of young girls enter adulthood prematurely, often with inadequate support. For many single mothers, the journey starts with teenage pregnancy, a life altering experience that pushes young girls into the hardships of adulthood before they are ready. Imagine being young with your whole life ahead of you, only to suddenly find yourself responsible for another life. These young women often face judgment from the very people who should support them: family members, neighbors, and their communities. Instead of receiving help, they're met with whispers, disapproving looks, and the weight of societal blame. According to a report,
Oh, why was Irvin muted? There we go. Please go ahead.
according to a report from the Philippine Statistics Authority, teenage pregnancy rates have drastically decreased from 8.6% in 2017 to 5.4% in 2022. This implies that a series of interventions would make a breakthrough. Nevertheless, it remains a grave issue among older teenagers because it keeps them in a cycle of poverty and lack of education. Often, teenage pregnancy sets off a chain reaction, which includes dropping out from school, limiting access to decent jobs, and forced entry into low paying informal jobs. This cycle of poverty becomes so hard to escape, and without financial and emotional support from the child's father, these women are forced to carry the weight of having a child alone. Thank you for listening, and I appreciate the opportunity to be part of this meaningful discussion.
Thank you, Irvin. And now we'll listen to Iris, please.
Greetings to all esteemed speaker, panelists, and guests. I will be reading an excerpt from my essay about the deeply rooted systems of this issue. So, let me start. The dynamic interplay of systematic failures has an impeccable and direct impact on teenage pregnancies. A Filipina teen's decisions are influenced by the environment they are surrounded by. What may appear as a choice from the outsider's point of view can be conformity, as their voice is often overshadowed by patriarchal structures and economic constraints within their reality. Addressing adolescent pregnancies can only be done by challenging the broken system that continues to perpetuate this trap. Through breaking barriers, we can create a safer and kinder future for younger girls. Your body, your choice is then not merely a performative slogan. Instead, it should be held bindingly to the entirety of society through garnering collective support and giving the female population a voice and a form of representation in affairs that greatly concern their well being. Thank you.
Thank you so much, Iris. All right, let's hear. Next up is Hannah.
Good day, everyone. I'm Hannah Vigilia, and I'll be reading an excerpt from my essay entitled Growing Bodies, Growing Minds, an essay on sexual education and teenage pregnancy in the Philippines. Teenagers are not fully developed. Their bodies and minds are simply neither equipped nor prepared to handle pregnancy nor its responsibility. Pregnancy is inherently a life-changing decision. A teenager's education, financial security, physical, and mental state are all affected. Just imagine the most common scenario. A teenage mother from the poor sector are ostracized, judged, and looked down upon in society, especially because of its quote unquote forbidden culture. On top of that, they have to work harder to provide for their child. Women and girls in particular take the brunt of this, becoming shamed for getting pregnant, even though most of the time it's not their fault. The severity of the number of teenage pregnancies only highlights the importance of the role of education. It becomes clearer that sooner, not later, the Philippines should take action and update the curriculum for sex education. In the end, the safety of the youth should be our collective goal. At any rate, it's not too late to be more open minded, and never too late for a change. That will be all. Thank you. And thank you for this wonderful opportunity as well.
Thank you so much, Hannah. And finally, we have Ava.
Good day. My name is Ava Revalo Isidro, and this is an excerpt from my essay entitled SOS. But I must obey the need to wait until marriage. Until then, I must remain chaste. My worth vanishes if I've been with a man before then. It is wholly dependent on what he takes, what he steals. My own government refuses to allow me to be taught, avoiding it like a plague. Education, how appalling truly. A bill meant to prevent adolescent pregnancy, withheld. They claim it teaches children how to pleasure themselves. They're all lies, doing whatever it takes to maintain the status quo. People, however, have fallen right into their web of deception. So I do too, welcoming the cunningly woven strings of untruth, embracing its silk as it wraps around my being like a vice, swallowing me whole. I have to, for if I learn it, I'll want it. That's what they tell me at least. That's all. Thank you.
Ava, thank you so much. Now that you've read, everybody knows why we're so excited to have you all here as representatives of the Philippines. And I'm sure all our attendees and panelists are looking forward to chatting with you in the breakout room. Now I'm delighted to introduce the moderator for the main event, our panel, former Global League Board member, Dr. Corinne Wee.
Thanks, Leah, and thanks to all the essay writers. That was really excellent. Good morning, good afternoon, and good evening, everyone. It's my deep honor to welcome you to today's panel discussion, Empowering Girls Through Reproductive Health Education, Global Insights and Interventions. We are joined by a remarkable group of experts in maternal and adolescent health who have not only studied this issue, but have been advocating for essential access to this education. Our goal today is not just to inform, but also to ignite action. So as you listen, I invite you to consider how your voice, your platform, and your network can be a part of the global solution. I'm honored to introduce our distinguished panelists. Unfortunately, Dr. Michelina Dreza is unable to join us today due to illness, but I'd like to present those to present to give a brief introduction. We will start with Dr. Kwame Adubansafo.
Yeah, good morning, good evening, good afternoon to all of you, and wherever you are joining us from. My name is Kwame Edu Bonsafo. I'm a full professor at the University of Ghana Medical School, and I'm into obstetrics and gynecology, and also my background is medical physiology and epidemiology, and I'm excited to meet you all, and today I'm going to share some insight from Ghana and also to relate some of the issues associated with adolescent people, and then also the pregnancy related issues among adolescents. And I'm excited to be here today to join this esteemed panel to discuss this important issue. As you all know, this is a problem we must discuss, a problem we need to confront, and also we must solve it. And I'm excited to be part of the team. Thank you.
Thanks so much for being here, Kwame. And then we also have another panelist, Megan Mukuria. Could you introduce yourself briefly?
Sure, great. Hi, I'm Megan Makuria. I'm the founder and CEO of Zana Africa here in Nairobi, Kenya. I hail from Connecticut, but I'm a dual Kenyan American citizen. I've been in Kenya for 25 years. I'm Harvard Leverett College, 99, studied cognitive neuroscience, and addressing systemic changes for adolescents and then comprehensive sexuality education. So I look forward to talking about that later today. Thanks.
Thank you, Megan. And then our final panelist is Dr. Ian Vasika.
Good morning, good afternoon, good evening. I'm Dr. Ian Vasika. I'm an OBGYN specializing in maternal fetal medicine and urogynecology. I'm extensively trained in GYN surgery. I also do research in epidemiology and OBGYN, and I'm a graduate of the Harvard Medical School Surgical Leadership and Clinical Scholars Training Program. I'm just very happy to be here. Thank you.
Welcome to all of you. So to start us off, Ian's going to share a quick overview of the research, a summary of the journal articles that were shared with you ahead of time.
Ian, are you able to share your slides? There we go.
Okay. Can you see that? Right.
Yes.
Okay. Great.
I can't hear
Okay.
anything. I don't know if anyone else
Like,
can.
no,
Okay.
no,
Yeah.
we're
Sorry.
just
Sorry
starting.
about that. Just had some technical problems there. So the learning objectives of today's program are threefold. First, to provide a broad overview of the problem of early and unintended pregnancy among young adolescent girls in sub-Saharan Africa. Second, to explore the role of the educational sector in the prevention of EUP. And lastly, to highlight some strategies for prevention through partnerships with NGOs and other local organizations. So the scope of the problem is one which is quite large. It is both alarming and a burning problem that desperately needs to be addressed by the global community. 1.2 billion of the total global population is comprised of adolescents between 10 and 19 years of age. Sub-Saharan Africa has an estimated 250 million adolescents, or 20% of the adolescents worldwide, and this number is rapidly growing. The geographical distribution of the median age varies significantly between the North and Southern Africa. The median age ranges from the lowest of 15.1 years in Niger to about 17.6 in Ethiopia and a high of 28.1 in Morocco. So as you can see from this graph, this figure, that Africa indeed is a very young country, and countries such as Uganda, Mali, Yemen, all have population, 70% of their populations are under the 30 years of age. In terms of the global distribution between North America, Europe, and Africa, the African continent has a very high percentage of the total population under the age of 30. 23 of the 49 countries in sub-Saharan Africa are considered low middle income countries, or LMICs. The problem of EUP in adolescent countries is compounded by a lack of resources, such as inadequate investments in education, poor access to sexual health, reproductive services, especially in rural areas, and societal attitudes which discriminate against female abortion and pregnancy outside of marriage. All of these factors contribute to high rates of early unintended pregnancy in sub-Saharan Africa. And you can see comparatively to India, Latin America, and the Philippines, they also have they do not have low populations of young people. In fact, the population numbers of young people are quite high as well. In terms of overall, this is just a graph to illustrate the fertility distribution of the population divided by sex and age. And to give an idea, in 2020, there were 538 million African children under 15 years of age, which is a ratio of about 1.6 African children for every American of any age. These are pyramids that illustrate the impact of high fertility or low fertility on a country's age-sex distribution. When couples have fewer children, the society's age structure changes, as shown by a narrowing at the base of the pyramid and a widening at the top. And this is representative of many of the sub-Saharan countries with high fertility rates. Uganda in Eastern Africa, which you can see on the left, has an age and sex distribution that shows a perfect traditional pyramidal shape, indicating a large proportion of the population of an extremely young age, the median age being 15.7 years only, reflecting that half of the population are children 15 or younger. In contrast, Tunisia on the right in Northern Africa has experienced fertility declines. Its median age of 32.7 is similar to some of Asian or Latin American countries where the population is aging at a faster pace. In Africa in the early 1950s, it was a high fertility rate of 6.5 births per woman, and little effort was made to reduce these rates through contraception or abortion. And since the year 2000, there has been a decrease in fertility rate, but only at a low rate of 0.03 per year. Thus, during this period, or 2015 to 2020, fertility rates have remained above 5 births per woman and have yet to lower at a meaningful rate. This is a graph of sub-Saharan Africa, of the countries which are divided into Southern Africa or Eastern Southern Africa and Western Southern Africa. And these countries include Ethiopia, Ghana, Kenya, Senegal, Democratic Republic of Congo, Zambia, Zimbabwe, and others. 23 of these member states are considered by the World Bank to be LMICs, whose inhabitants have a per capita gross national income between $1,000 and $4,255 per year. Nevertheless, there's great variation in the social and economic development that exists between these countries and others, which are more upper middle or high income. And this just highlights some of the significant inequities and disparities among populations with regard to healthcare, education, and other basic societal needs. So what are adolescents and what does the term mean for human development? Adolescents are individuals aged from 10 to 19 undergoing periods of rapid growth and development marked by significant cognitive and physical changes. They're also at increased risk of developing sexual and reproductive problems such as STIs, pregnancies, and HIV. Boys and girls become sexually active, putting themselves at high risk for these problems, for SHR problems. And this is especially evident in sub-Saharan African countries, which comprise 23% of the total population, are comprised of adolescents. Early and unintended pregnancy can be defined as pregnancy occurring in between the ages of 10 and 19, which is either unwanted or occurring prior to the expected time of having a family. One of the most significant risk factors is the use of more traditional, less expensive methods of contraception, such as condoms, and less utilization of more modern and costly methods, such as IUDs and oral contraception. Recent studies indicate that preferences and attitudes among healthcare providers towards adolescent contraception significantly contributes to the higher rates of early and unintended pregnancy. Ironically, data reflects that adolescent girls using traditional methods of contraception, the rates of unintended pregnancy are even higher than in adolescents who do not use any form of contraception. So in fact, over-reliance on traditional methods contributes to an increase in the number of unintended pregnancies in sub-Saharan Africa. So how does unintended pregnancy more specifically relate to the adolescent population? First, there's a high incidence with almost 14 million unintended pregnancies recorded every year, and 44% of those among adolescent girls. Second, there's geographical variation among the countries as to the prevalence, with an average of 22.4% for the region, with a low of 10% in Gambia and 46 in Angola. And lastly, the adolescent fertility rate is double the world average of 39 births per adolescent worldwide, with the Eastern South African region reporting 66 to 90 live births, with some countries over 100 live births per 1,000 adolescents. These numbers are alarming and really require immediate global attention. So what are the consequences? EUP can be understood from a biopsychosocial model. Most importantly, adolescent girls have a high risk of maternal mortality and morbidity compared to adult women, sometimes somewhat 5 times higher for girls aged 10 to 14. And they put themselves at increased risk of obstetrical complications such as preterm labor, low birth weight, neonatal death, and higher risks of neonatal death, which are higher during the postpartum period. The psychological impact, of course, they are prone to depression given the significant disruption to their educational growth and development, and also limiting their prospects for future employment. The societal impact, although adolescent girls clearly have sexual and reproductive health rights, which have been established, there are still significant barriers, which include lack of knowledge due to inadequate sexual education in schools, limited access to sexual health reproductive services, and harmful social norms surrounding premarital sexual activity and pregnancy. A strong societal influence exists on how adolescents should live their lives and the way they actually live in reality, resulting in tremendous confusion for them, especially among themselves and their peers. The influence of cultural norms and behaviors towards unintended plays an important role in what specific actions can or not be taken by adolescents. Most cases of unintended pregnancy are related to sexual activity that occurs outside of marriage, with a higher risk among young girls aged 15 to 19 compared to those 20 to 24. Physical abuse and lower socioeconomic status also contribute. Unfortunately, the societal stigma placed on these adolescents often results in poor medical management and poses risks to both maternal and infant morbidity and mortality. And with that, I would like to end my presentation here. Thank you very much for your attention.
Thanks so much, Ian. I think Ian gave us a really excellent summary of the problem and how prevalent it is, especially in lower income countries. And so now I want to kind of go around to the panelists and ask specific questions, and please jump in the chat if you also have additional questions that you want to ask the panelists. So Kwame, I was going to start off with you. In your personal experience, can you describe the medical and psychological consequences for adolescents that have unintended pregnancy, both for the mom and the child?
Well, thank you very much. When it comes to adolescent pregnancy, it has a long-term consequences and even immediate consequences as well. Let's look at the mother. That means adolescent mother. Once pregnancy occurs, they psychologically become disturbed. It can affect their education. Let's remember that it blocks the opportunity for further education, and at the same time, future opportunities are all blocked. So that can really cause a lot of psychological issue in the mother. Then moving on to clinical, you realize that, as one of the essay mentioned, you realize that they are not fully developed. The pelvic is not fully developed. The psychological and then the general body is now transitioning from childhood to womanhood. And that transition is quite critical. And that is the time that these adolescents are vulnerable to a lot of things. They are now learning to live as adults. And so they can go through some of these complications. And we know that in pregnancy, there's a lot of changes, which we call the physiological changes in pregnancy, that can actually shift the woman's condition from being normal to another level. And adolescents are not really prepared. They have not been, they haven't had preconception care. They haven't thought of it at all. And moving to those kind of conditions can really affect them. And so in pregnancy, they are prone to anemia, they are prone to infections like in our country, malaria, and then they are also prone to other conditions like preterm labor, where they give birth to prematurely and they have premature babies. And then when it comes to the actual delivery time, their pelvises are not fully developed to be able to go through the process of childbirth. And in Ghana here, most of them actually have to go through cesarean section for the delivery. And you can imagine, even they haven't started giving birth, the first birth they go through, leading to some of these things, can have a very long-term complications for the woman, even as she grows. I mean, that young woman. And I think that this is something that can really worry the woman. And then apart from that, some of them actually also get complications like postpartum bleeding, hemorrhage, and then infections and all that. And the critical point of this is that if you are not careful, then it can block their chances of becoming whatever they wanted to be, their aspirations and all that. When we come to the neonate that is born, I initially mentioned that you can have a prematurely born baby, and that baby will have some conditions like anemia, they can have jaundice, and let's remember that these young women are not prepared to take care of them. And so nutrition issues, breastfeeding issues, early neonatal issues, and they can actually, you can have neonatal deaths because of the prematurity and some of the conditions that they can get, including preterm, including neonatal jaundice and failure to thrive in the immediate postpartum and then during the time of growing. And so these are some of the maternal in terms of adolescent and then the perinatal complications that can be associated with adolescent pregnancy and childbirth. And this is something that as a country we need to be quite careful about. We still lose a lot of them here through maternal mortality. And as we know, any woman giving birth should not die. And why? When it comes to the adolescent mother, because they lack information, some of these conditions or complications are higher in them. And I think this is the right time for us to discuss it, the right time for us to face it, the right time for us to confront the issue and also solve it. And I'm excited to be part of this. Thank you.
Ian and Megan, can you share any personal experiences that you've also had in interacting with women that and adolescents that have had early and unintended pregnancy?
Yeah, I can speak to some of that. In my experience, I fortunately have not come across too many. However, I have come in contact with young girls who've had been exposed to early sexual contact with other issues related to mainly sexually transmitted diseases and other infections which have complicated their lives. So this really presents a major public health issue in the sense that a lot of this is being driven by the environments in which they're growing up in and the attitudes that are being sort of circulated or cultivated among their peers and among the educational institutions and other factors. So I think that if we really are to address the root of the problem, we have to kind of understand it, not just in terms of treatment. Modern medicine can pretty much treat, or we can deliver, or as Kwame was saying, manage these pregnancies, however, through cesarean section or other means. However, it still doesn't eliminate the risks that these girls are being exposed to, the risks to their own health and the health of their newborns as well, and the bigger sort of societal problem which comes out of this. So I think it's a multi-dimension factor problem issue. The data is pretty convincing in terms of the epidemiological data from Africa. And I think we all have to really, the solutions going forward are to come up with means to establish sort of more standardized approaches between countries, public policies, and how to manage these circumstances that arise. Because I think, as Kwame was saying, it's not the medicine, but it's the negative impact it has on their growth and development and on, I would say, as responsible adults, on all of us at large, I would say.
Yeah, I mean, I would come at it from a different perspective, not clinically. And from my 20 some odd years doing this, starting as being like a mom to kids who had left the streets. In our research study that we did, that's in one of the links there, the average age of first sex for girls in Kalifi was 11.9 years old. And I want us to just sit with that for a minute because these are girls who are not yet even necessarily menstruating. And there is a huge power dynamic with older boys and men, ages 5 to 10 years older. This is also now in a post-colonial context where working indigenous systems were intentionally discarded in order to place a more command and control system that was also coming in with Islam and Christianity and stuff. So a lot of kids do not know how to say no to people in power, right? And so now you're putting that in a sexual context as well. And girls really do not understand what is appropriate and inappropriate touch. How do I say no? Am I allowed to say no? So it really starts with understanding how we got there to this place where kids do not know that they even have any agency even over their bodies. I mean, we developed our reproductive health curriculum from kids asking questions anonymously on pieces of paper all over the country. And a lot of them that come up are like, if a teacher touches my breast or my bottom, is that okay? Like they literally don't know basic 101 that their body is their own and they have a right to that, like what we were hearing in some of the essays. And so it begins with societal frameworks where we have to educate boys and girls from younger ages. 11% of all sexual violence in Kenya is against children under 5 years old, right? So you really have to start with age appropriate education all the way through so that when people are having sex, it's consensual and wanted. And so that's kind of what we've been working on is leveraging menstruation, which everybody agrees girls should have pads, they should manage their period with dignity, as an inroad into consent, human rights, gender equity, and all these things. And I can kind of unpack that later in the questions. But that's been our experience is that when you give kids education, they're able to make decisions that are in line with their own desires for their education, for everything. And usually that's saying no to pressured sex. And then the last thing I'll mention is a lot of it is transactional for commodities, because there's a lot of pressure to get money to feed your family, to get money for sanitary pads, to get money for all these other things. So we've got to remove those barriers in order to keep kids of all ages safe, and especially during puberty.
Yeah, so Megan brought up a lot of great points from an educational point of view. Ian and Kwame, given these rapidly rising fertility rates, what other sorts of interventions should be implemented to reduce this alarming rate of fertility?
Right. So first of all, let me mention that for instance, in Ghana, we have a high burden in Ghana. For instance, about nearly 15% of adolescents are getting pregnant, and you see, if you look at it too, about 10% of them are actually giving birth. What is the main problem here? The main problem is that young girls are actually getting married early because of culture, our culture. So you can see that about 10% of adolescents, let's say in Ghana, have been in some form of marital, relationship. Some are actually out of marriage. Maybe nearly about 0.5% are out of marriage. Some are having some informal relationship, and maybe about 5% are still in marriage somehow. So it's a culture. We need to think about how we can modify the culture if we cannot even break it all together, how we can modify it to remove some of those taboos that we are still hanging on to. The other thing we need to do to be able to do that, the main point is that education, and I say education and education. Education is what we need to really, I think at this point we need to consider strongly, because once we're able to empower the woman, the adolescent, he gets the power to negotiate on a lot of issues in relation to their sexual reproductive health, issues related to sex and other issues, even economic. They are able to defend themselves. But here we still have a lot of people who still have not had education. They haven't had a formal education, so I think that contributes. And let's not forget, I think that is the underlying issue, poverty and poverty. Everything it revolves around poverty, because even school fees, what to eat, what to wear, whatever you want to do as a young lady in Ghana, born to a family that is not capable of taking care of your basic needs. I mean, basic needs. And so you can just easily be convinced it's not their fault. Let's not blame them. We need to start from another corner. We need to understand them and educate them to defend themselves in situations. Most of them are pushed to the corner, and all they have is to give in. And I think that education, poverty reduction, and also mainly trying to empower our women, and also education should be global, not only to the young girls, our parents, our siblings, our family members. Ghana and in some part of the sub-Saharan Africa, we cherish family. We have extended family, and they can contribute. Sometimes the decision for a young woman to get into marriage is not from the father, it's not from the mother, it's from the head of the family. And it's a culture that even the parent cannot. And I say that education and education, and also trying to reduce or break our taboos that we have in our country. That can be a very good source to reduce teenage pregnancy and all the complications associated with it. Thank you.
So I hear you all describing these really deep-rooted cultural, educational, financial barriers, and I think they can seem really daunting to people listening. What are some past interventions in sexual and reproductive health that have been successful to kind of that we can maybe jump off of?
Right. In Ghana, we have done a lot. This education and the Ghana Health Service has done a lot in improving, encouraging women empowerment and all that. But we still have a challenge. And so in various schools, we have some NGOs who go around schools to educate women, tell them about their menstrual hygiene, reproductive health, and all that. But still, it looks like sometimes we start these processes, and monitoring, evaluation, sustenance becomes like a problem. And I think that this is where we need to really make sure we follow up strongly. We need to talk to some of these young girls in languages that they can understand. It's not just standing and talking. Can you talk to her in a language that she understands? Can you talk to her? Can you come to her term and at her level and be able to talk to her for her to understand? Sometimes we need to also talk to the parent, because sometimes the parent will push them into it. It's not their fault. The parents, they don't have anything, and they say, you have to do this. I've stopped. I'm done. I can't get money for you to go to school. I can't get money for you as your to take care of your things and other issues, panties and other things. So these are issues that the government has done well in its part, but we still battle with it. And I think that we will need all levels, all corners, and our contest. I can understand our context is quite different from other contexts, let's say in the high income countries. We need to leverage on the taboos that we have talked about, need to still tell them that while they are still important in keeping us true, we need to look at the ones that are causing harm to our country and our people. And then once we're able to do that, I'm sure we'll be able to get there. Thank you.
Yeah. If I can just chime in and add on that. So we spent the last about 15 years developing a reproductive health curriculum co-created with government, communities, kids themselves. And what we found is that, as I mentioned, menstrual health is generally something that, even though there are a lot of taboos around it, like you can't play sports when you're in your period, generally everybody agrees, whatever cultural framework that they're coming from, that girls should be able to manage their periods with dignity. And so we leverage that to educate girls and boys around menstrual health and taboos, and look at human rights versus social norms. And I'll push back a little bit that high income countries are are doing better at this, because the US, we could have a whole webinar on how dysfunctional the US is. I think the US needs African solutions to solve some of those problems. But what we found basically is that you teach kids, hey, you have a human right to play sports when on your period. So here's some pads, go play. Then God doesn't smite them, the world doesn't end, and even their cramps feel better. And so suddenly they have this experiential understanding of human rights versus social norms, and they choose human rights. So they go very quickly in our proven study. This was a 2-year randomized cluster trial, from saying girls have a right to play sports to saying boys and girls have a right to equal education in the classroom and to share household chores, to saying mom has a right to not be beaten by dad or vice versa, very quickly. And so leveraging menstrual health is this amazing way to get into reproductive health. And what we found is once we do that, girls very quickly, and boys too, understand consent, understand how pregnancy works, understand like all of this stuff. But the building blocks begin with making sure that adults that are educating them have a human rights framework. And that's why the government of Kenya actually approached us to embed our curriculum, which is all story and comic based, to your point, Doctor, about in their terms that they understand, right? It's fun. They really want to read it. And so now we're working with the government to do trauma-informed teacher education to help the teachers have that human rights framework and to work through their own trauma that came from not having that framework. And then to actually have these topics tested that teachers then get tested on themselves for complying to around reproductive health education. And we all need to keep pushing the lines, because like right now in Kenya, you used to be able to teach contraceptives to adolescents. You're now not allowed to. And so the laws of the country can be either helpful or harmful. But that's what we've been able to do in Kenya. And we're, about a year away from really embedding it into the Kenyan curriculum and really seeking to replicate that across other countries, because it's a really great way to make inroads into seemingly very intractable issues.
So let me quickly add that it's very good to look at all this. Like in Ghana, as I mentioned, we have policies, but how can these policies be optimally implemented and maintained? So we have adolescent-friendly services around. Are we able to maintain it true and true? We even have national adolescent health policy. Policies are there. NGOs are working hard. Sometimes getting the implementation at the community level, at the family level, at the household level, that's where we tend to have challenges. And so we need to still consider some of these things and try to implement it at the community level. We have comprehensive sexuality education and all that. But we have got to a point where we need to kind of practicalize the policies. Let's make them work in our context. And when we do that, I'm sure we will continue to get some improvement with respect to adolescent issues. Thank you.
I think we're so lucky to have three of you here, because not only do you understand like the huge scope of the problem and the severity of it, but you've also implemented it on the ground level. We're also really lucky to have some future young leaders here in our essay contest writers. And so if you could give them any sort of advice about how to start change in their own communities, what advice would you give them?
Megan, do you want to go first?
I mean, I would say lean into where your heart is beating the most, and spend a lot of time just listening and loving people. I mean, all of what I have achieved so far came out of just really loving adolescents that were kind of in my area, and find people that are doing work that you find inspiring, and see if you can volunteer or, work there. And just, yeah, lean into the yes that like your heart and your mind are feeling. I moved here to Kenya when I was 23 after doing cross-cultural work in the US, and um, everybody said I couldn't do all the things that I'm doing. And you just kind of have to block out some of the naysayers when you know that they're not leading you in the right direction, because there's a lot of pushback from parents, from peers, from others. But stay true to the North Star in your heart, I think, is just kind of my advice.
Right. Thank you. So, I think that as we all know, currently too many girls are becoming mothers too soon, and of course, their dreams are, cutting short too early these days. And as you can see, their future is also getting lost, even as they even begin to have any future at all. We have mentioned the main issues. The main issues relate to, we have mentioned that poverty, economic issues, and we also mentioned culture. So I think that it's about time we let our women understand that they should look beyond what they see. They should look at the ultimate goal, because poverty actually, fuels vulnerability. They become vulnerable and become desperate for something, and then it ends up. So we need to encourage them to build their own future, and also encourage our mothers to let them understand that the hurdle they are going through now, there is some success or future beyond it, and they need to push a little more. They don't have to give in. And at the same time, they should be able to learn. We need to give them some life skills that can help them to negotiate when they are alone. I mean, at some point where parental control is not available or readily available at that point. These are things that I think we need to consider. And then misconception. Misconception comes and is related to the taboos that we mentioned already. Some of them we need to address. In fact, some people even say that the use of contraception can lead to infertility. And they punch this into our young girls. They push it on them. And so within a short while, someone gets pregnant. Let's face it, after pregnancy, if you try to consider maybe termination in our part of the world, it can be risky, because here again, they don't get the right people. They use medications. They can do very major or serious procedures at home. They bleed, and it gets to a point where they get complicated, and we lose young women through that. And so these are some of the things that I think we should consider. Even though culture shapes beliefs, it can also affect the outcomes of these women, and we need to find ways and means that we can encourage them to get the knowledge and be able to critically think about issues. They should get the life skills to negotiate, for also to protect themselves, and at the same time they should have some safe spaces, and then they should also develop some social networks where peers can encourage, because adolescents can actually learn from each other. At the same time, if they don't get the right information, then they will learn the wrong thing. And so this is a point that we need to give them the right information so they can learn the right thing and be able to defend themselves when they are alone. And I think that when we are able to do that, it will really help. And this is the point that we want to say, that education actually is a bridge to the opportunities. But when these women, they get dropped out from school, then that collapses everything and their future is cut short. So thank you.
Thank you so much to all of our panelists for sharing their expertise and personal experiences with us so far. And while the scale of this problem and its impact on girls in low and middle income countries is unacceptable, the solutions that you guys have offered so far is really encouraging. So we're going to get to chat a little bit more with our panelists in our breakout rooms. So I'll hand it back to Leah.
Wow, thank you, Corinne, Megan, Kwame, and Ian. Everyone, you've all been listening a lot now, so we want to give you the opportunity to chat and participate, right? With our panelists and the students that you met earlier. And you'll also be meeting representatives from 3 organizations who have previously participated in our annual expos. They'll give brief introductions of themselves and other groups, and then the floor will be open for discussion. And please note that we do have some ground rules for the breakout rooms. Themes and broad ideas can be shared, but personal stories stay within the room. There's the expectation that this event is not recorded or to be shared in any way. Please share airtime and share responsibility for the group's, free-flowing discussion for its success. Please treat each other with respect and consideration, and because everyone has come here to learn, to grow, and to share. All right, RT is now going to assign us to breakout rooms. We'll be in there for just under 25 minutes, and then we'll reconvene back in the big group, and there'll be a global lead moderator in each room. All right, I hope you enjoy this time. Yeah, I think there'll be 4 rooms.
I hope everyone's been assigned to a breakout room. Please accept and move to your breakout rooms.
Invitation. I got it, but I didn't tap it quickly enough. Is it possible to be assigned to a room?
Sure.
Thank you. Oh, I see the button. Maybe I.
Wow. Just
Stephen, you haven't been assigned?
you've been assigned.
I noticed earlier there were 3 Stevens. Where, yeah. Can you assign the one who's I don't know. There are 3 Stevens. I don't know what happened. Okay. But we still have one who is not assigned. So maybe put him in the other room where you assigned the other Steven in room 2, I think is where you have them, right?
Yes. Yes.
Okay. Maybe other people are using your link. Yeah, I see 2. Yeah, I see 2 Stevens. So maybe put them both in room. Put them in room 2.
Two.
Right?
Yeah, I've just done that.
Okay.
We have done this. Can we request everyone to accept this to
Stephen, have you guys accepted your assignments? Esther, is there an issue? Okay.
Could you reassign me because I wasn't quick enough either, please?
Is that Mila?
Yep.
You can just move them into the rooms too, right? No?
Do we know if Aliza has joined? Because it just still shows me not joined. Oh, it shows me as joined.
She's
Sorry.
in room 1. I see Elisa in room 1.
Okay. I only see room
I have another
4, not moved.
Yeah, Mila is supposed to be in room 3.
I'm just
Okay.
trying to move rooms and see if they're able to join because I'm not able to assign them to the same room again.
Oh, okay.
Yeah, Mila's not joined in the other room as well.
Yep, yeah, there she is again. Okay.
But rest all have like
Well, I have, who do we still have here with us? We have Arilim, Bene, Moses, Alice, Stephen. They have not joined either?
no. But I keep moving them,
Okay.
so they may not be available to accept that.
Okay, yeah. I think this is somebody, the other is somebody who's using Stephen's link. But can you not join from your phone?
I think
Okay.
so too. Like,
So
you
you tried
know.
to move, you tried to move Mila in, right?
Yes, I did.
RT?
To 4, from 3 to 4.
Okay. Oh, there she is. She's in. She's in.
Okay.
She's in. And then the others we think are not present?
I think so. I'm gonna try move them again around.
Okay. Yeah, I'm not touching anything, but I thought I would try to visit the different rooms and see how they're going. I'll leave you here for a minute.
Sure.
And then you have when to send the 1 minute warning, right?
Yes, yes, yes.
All right, I'm just gonna pop in. So I can join and leave, right?
Yes, yes, you can.
Okay, I will do that.
All okay, Leah? You're on mute.
I cannot see the rooms now, so I can't. Yeah, I see what they mean, that once the thing goes, I can't see the other breakout rooms. Let's see. Breakout rooms. Ah, there we go. Okay, back. Okay, I'm one. I'm gonna try room 2 now.
Okay, welcome back, everybody. I hope you enjoyed the opportunity to connect with each other and learn more about our topic. I would like to invite Dr. Estera Borxa, the Vice Chair of Programs, to lead us in the closing activity together.
We have Estera. Did she not come back yet?
I think she's not back yet from the breakout room.
Okay. Well, let's start. Did you get any takeaways? What were the new things you learned? Let's share them in the chat while we're waiting for Estera. Did you learn something new? Did something really hit you? And even questions for the panelists, if you want to put them there, then we can try and get them to the panelists at some point. Oh, there's Estera. Hi, Estera. I just asked them to put stuff in the chat, but I will leave you to carry on the activity.
Okay, great. Yeah, that was riveting discussion um in our breakout rooms. As the vice chair of programming, we always try to mix things up in our in the programming section of like how we run our events and the type of events we do and how we do the panels. And so I'm really excited because we're trying something new today as far as the programming and how we did this today. And I'm really proud of it. I think it was so good. We talked about problems. We talked about solutions. We talked in our breakout rooms. We had a great presentation on the work that's being done on the ground in Venezuela. So I'm just grateful for how our event has turned out. So I'd like us to just kind of reflect a little bit about our events and think about all that we learned today. So empowering girls with knowledge about the reproductive health is not just an educational initiative. It's a human rights imperative. As we come together across continents, disciplines, we ignite a global movement where dignity, choice, and health are non-negotiable. So let's be more than a conversation. Let it be a catalyst for generational change. So I want us to take a moment of reflection to think about our conversation today and think about how we can transmit this conversation and create generational change in our own communities. So I'd like to invite you to drop one of the following in the chat. Either a meaningful takeaway from today's events, one action step that you'll commit to in your community or your profession, or just a word or a phrase that captures your hope for girls' empowerment worldwide. So if you can just take a moment to reflect, and if we can all engage in the chat together about what is our takeaway from today? What is one step that you might commit to join in the community or profession? For me, I think my phrase is hope for change. I think that's what I take from today's session is that there is hope for change. So take a moment of reflection and please add that to the chat. The critical importance of contextualizing to local communities. Beautifully said, Rapal. Please keep adding to the chat. Education across generations. It's been enlightening to hear other groundbreaking work done in Africa, especially the curriculum development involving faith leaders in order to get greater buy-in. Great. Starting the conversation early. Talk about girls' health more and more and more. Are youth hopeful that they will save their generation? From our Vice President RT Education, but also help them alleviate from poverty and give them choices. Irene says focus on rights. From our panelist, Ian says the importance of education for the physical and emotional well-being of young girls around the world. Government policies should include interventions on SRHR. It's great. The essays were very moving and informative. I learned so much. I will second that. They were very powerful from our young people. Thank you for being here. Education for girls and boys aimed across generations. Beautifully said. Educate girls both about health and also about their own strengths to alleviate and make choices, grow their characters and minds too. Wow, beautifully said. Okay, we'll continue to put those in the chat and continue to reflect about the progress that we're making in such a hopeful discussion today. Annie says important not to regress in the so-called developed countries, which is a great point. The need to work from the group up, beautifully said. As we continue to reflect and end out our time today, I'd like to have our Vice President, Dr. Arti Gupta. She will close us out.
Thank you so much, Estera, and thank you everyone for this very, very powerful and educational discussion. I'm loving the messages in the chat box, and I just cannot stop reading. But I would like to thank our esteemed panelists for taking the time to join us today and for informing us how we can work together towards combating teenage pregnancy in low and middle income countries. Thank you for sharing inspiring possibilities that you recommend education initiatives bring about to create a future for these girls who so often had theirs taken from them. We are so grateful to our students. It's the first time we've tried something like this, but Ava, Irvin, Hannah, and Iris, your thoughtfulness, your passion for women's empowerment gives us hope that your generation, as represented in our contests in over 20 countries, will continue to bring this world to gender equity. We are extremely hopeful. Your participation made this event very, very special. So thank you. We're truly grateful. Thank you to Global We Board and especially to our fabulous programs chair, Vice Chair Estera, Global We member Dr. Ian Vasaka for bringing this event together. We would also like to take this opportunity to invite everyone to our upcoming events. As on July 17th, live-streamed workshop at the UN hosted by Mediators Beyond Borders International, MBBI, that Global We is co-sponsoring together with Dr. Estera. The topic for this discussion is From Exploitation to Empowerment, addressing sex trafficking through peace building, policy, and the power of story. On July 25th, our movie club will feature Wajda, a Saudi Arabian film from 2012. Please look out for our emails with details about the event in the upcoming weeks. If you don't get our emails, please sign up on our website, edgeglobalwe.org, and also follow us on our social media handle @edgeglobalwe. The details are in the chat. At Global We, our aim is to focus on issues affecting women globally. So if there is a topic or if there's a speaker you are passionate about and would like to plan an event around it, please do connect with us by sending us an email to programs_estera@edgeglobalwe.org. Again, it's in the chat. We would be happy to invite you to champion the event as well, so please indicate that interest. We hope you all have enjoyed today's important discussion. Together with our flagship programs, the essay contest and expo, today's event created the education, the dialogue, and the connection. Thanks again to our panelists and all our participants. Stay safe and have a good rest of the weekend.